This is the STL Medical Weight Loss Radio Show with Dr. Joe. No more talking, let's go.
Welcome back to the STL Medical Weight Loss Radio Show. I'm your host, Dr. Joseph Moleski. Today we're talking about making obesity and chronic disease optional. And we've talked about a few things about, I'm seeing more and more patients coming in with prediabetes, coming in with signs and symptoms of that prediabetes, tingling in their feet, just feeling fatigued, the, spikes of their glucose, ups and downs, just that, afternoon crash, and, this central obesity or central weight around their waist, hips, and thighs that they're just wanting to correct. They want to get their confidence back. And so, I'm a hospital physician, so I work in a hospital setting, and I get to see, unfortunately, patients coming in through the emergency department, and they're, having these, chronic issues leading into acute issues. They have long-standing high blood pressure, long-standing diabetes, uncontrolled, and then they're coming in with a heart attack or stroke. And I see that. I admit them to the hospital. I get, the specialists on board. We, fix their heart, get MRIs of their brain, get a neurologist for the stroke. And so I see this day in and day out. This is what I do. And so the reason I got into this is I wanted to, intervene in somebody's life in their 30s or 40s, so then they weren't coming into the hospital with a stroke or heart attack or something that's essentially a devastating diagnosis and can change your life forever. So this is all about educating you, and then you guys understanding the risk factors associated with metabolic disease or metabolic syndrome, which is, increased weight circumference, elevated blood sugars, elevated blood pressure, and elevated cholesterol. And so I just want to educate folks that we're here to reverse disease at STL Med Weight Loss and then prevent disease. That's what we want to do. And so I one of the things I see is, and it's kind of sad, it's really sad, is we have patients that are not educated about what they should be consuming. So even yesterday I had a patient that was chatting with me, and he was working out avidly, and he's in the gym, and one of the things he said is like, what I do is I drink a lot of protein in the morning, and then I have a big bowl of cereal, and I was like, okay. And he's a diabetic, and one of the things that I said is I was like, wow, like, okay, you do the protein, that can spike your insulin as well, but doing the high sugar cereal, that's going to, essentially ruin your day. And what I mean by that is if you start your day with a sugary meal, whether it's cereal, oatmeal, bread, donuts, anything that has a lot of sugar, you could even start your day inappropriately with orange juice or an orange or a pineapple. So that's going to spike your blood sugar, that's going to spike your insulin, that's going to cause insulin resistance. And then the rest of your day, you're going to have these ups and downs with your blood sugar. And if you do that for years on end, then you're going to develop obesity. You're going to develop, it's going to be harder for you to lose weight. Then that could lead into, further consequences. So starting your day and having that education surrounding like why I need to start my day with, a proteinaceous meal or something that's savory versus something that's sweet is what we like to do at STL Med. We want to give you some, basic knowledge on what you should be consuming from a nutritional standpoint. Also, the educational piece regarding some, physical fitness and some lifestyle interventions that you can do. And then what we do is we pair what you're already doing with a little bit of education on our end to these medications. And when we pair them together, we can see the synergy between the two, systems, the nutrition, the exercise, plus the medications. And what they do is they work together, reducing your insulin resistance in your liver and pancreas, resulting in that 5 to 15 pound weight loss in the first 60 to 90 days. And you can see it pretty rapidly. I know there's been a couple patients that I've had on the show that have already lost, 20, 30, 40 pounds in a short period of time. And what we also want to do is make sure that these results are long-standing for you. There's some sustainability in it to where you don't just lose and then, okay, I'm going to gain it all back. We want to walk with you throughout this journey to make sure that you're successful. That's our goal. And so I really do believe food is medicine, and it starts what we put in our mouth, but also, food is one part of it, nutrition. Diet and exercise is part of it, but the other part is reducing that insulin resistance that you've built up for many years in your liver and reversing that. And so that's the next thing I would like to talk about. So when you have, obesity or insulin resistance, I've said this in the past, but if you want to just do a quick assessment, you stand up, look down. If you have excess body weight around your hips, thighs, and especially your abdomen, you're probably insulin resistant. And when I say that, that means that your liver likely has some fat buildup. And so I want to go over kind of what happens when you're constantly craving sugar, you're constantly eating sugar. I want to just go over kind of what happens from a biological standpoint. So sugar is composed of two things, fructose and glucose. And fructose is a molecule that once it goes into your liver, it kind of causes inflammation. And what it does is it's broken down and it causes fat accumulation. So when fructose is broken down, you get fat, and then fat kind of overloads the liver, and then it makes you insulin resistant, and it makes you feel fatigued. You're not able to lose weight. I've had multiple patients come to me and say, hey, I'm doing CrossFit. I'm doing 400 calories a day. I have a nutritionist, and I can't lose weight. I start them on the medication, and then they start to lose weight. And the reason is what happens is this medication reduces that amount of fat or inflammation in the liver, and then what you're already doing, your diet, exercise, your nutrition, then they both work together in harmony, and then you're able to lose the weight. So as I said, my wife's been on this show, multiple patients have been on the show. We use this as a tool in order to make sure you're successful. That's what we do. And so I would like to just encourage our listeners, if you're fed up with, living with being on a bunch of meds, we see that commonly. A lot of patients that come in the hospital, they're on 26 meds, and you're willing to make change, and you're willing to just stop. You're willing to just say, hey, I'm done. I want to try something different, and I want to try to prevent future disease and try to change the trajectory of my future and my life, and I want to get a hold on it now, like today. I think the first thing that you should do is just look yourself in the mirror and say, are you worth it, and what's your why? And the other thing I want you to say to yourself is the what if. What if? What are the consequences if you don't do this? That's what I want you guys to think about. What are the consequences of long-standing uncontrolled blood sugars, uncontrolled high blood pressure? Is it more meds for you? Is it more pills? Is it a surgery? Is it an ER visit? What is it? What are the consequences of you not doing this? And I know it sounds kind of harsh, but it's the truth. You just really need to have that conversation with yourself. What if I don't do it? And what if I don't start thinking about my health as number one? Am I worth it? I need to invest in myself. So I would encourage all my listeners right now, if that rings true to you and you want to get a hold of your health, I think you should first start by booking an appointment at STLMedWeightLoss.com or giving us a call at 636-628-6604. We'd be happy to help you.